I gave up mom guilt long ago, except for every time I take my kids to the dentist. Do they brush twice a day, floss every night? Yes, maybe, I think so. I hold my breath as they look for plaque and tartar and gasp, those ominous emerging cavities. And then I always leave with the firm resolve that we're going to be perfect brushers and flossers. I'll line them up like the Von Trapps. They'll open their mouths for inspection. I'll blow my whistle and I'll go down the line, peering at their pearly whites and handing out flossers. But a few nights in, I inevitably slip into old habits. I remind them to brush and floss as I wish them good night, and then I just hope it's actually happening. Welcome to the Family Lab podcast, where we embrace the fact that raising kids and running a home is one big experiment. Today, we're back with my good friends Megan Robbins and Laura Nielsen, this time to talk about oral hygiene. Megan has been a dental hygienist for 25 years and, in fact, is my dental hygienist. So she is the they I talked about in the intro, scraping our teeth to find all that hidden plaque that our toothbrush and floss should have eradicated. She knows the truth of whether anyone in my family has been brushing and flossing well. I wish you could all take a turn in her chair, but this episode will be second best. She's going to teach us how to teach our kids to keep their teeth sparkly clean, including a demo with some giant choppers. So you might want to watch this one on YouTube rather than just listening, or at least show your kids that part. She'll answer some of your burning questions like, should you floss first or brush first? Which would win in a fight, regular floss, flossers, toothpicks, or waterpicks? How bad are energy drinks and soda for your teeth? And what about vaping? We also talk about strategies for non-compliant children, and things may get a little out of hand when I decide to prove just how large my big podcasting mouth actually is. So, what are our goals with our kids for teaching them oral hygiene?
So I don't want to brush my kids' teeth when they're like in college. So the whole goal is to get them to be independent. But really, I want them to be effective because I know what type of pain tooth pain is. There's no worse pain than tooth pain. And so really, I want my children to be effective in the way that they're brushing and flossing their teeth. And also my patients. There's such low education in terms of dental IQ, even in affluent areas.
Huh.
So I feel like even though I've had people who have brushed their teeth for 60 years, they are learning lots every time that they come in. So for example, when you brush your teeth, you really should floss, use mouthwash, and then brush your teeth last. Or take your medicine before.
Floss first?
Yeah.
Do you floss
This
first?
is revolutionary for me.
See?
Oh,
Yes.
I've been doing it wrong for a long time.
Yes. You can water pick first, you can floss first, but the last thing that you're doing is you're actually brushing your teeth. Because after you're done brushing
Really?
your teeth, you just spit out the toothpaste. You do not rinse toothpaste off. You're supposed to leave a small film of toothpaste, especially if you're using like a sensitivity toothpaste or like a nanohydroxyapatite toothpaste. You really want a small film of toothpaste left on your teeth after you're done brushing. So nothing goes on your teeth after you're done brushing. So you want everything done before.
Okay. So my cousin was right. We were roommates in college. And so my cousin was like, you got to floss first because it's so much more satisfying to get those chunks out. Like,
Oh, yeah.
so that was just from pure satisfaction, but it
Yes.
also makes sense from a dental hygiene.
Yeah. Yeah. So, I mean, those are the things that like you teach on a daily basis that people don't realize that really you have an order of the way you should do things.
Okay.
Yeah.
Okay. So let's go back to just a term you use, dental IQ. I like that.
Okay.
Yeah. Yeah.
I feel like a lot of things we learn are like on commercials or on like movies and stuff. I feel like most of our parents didn't teach proper skills. And so as a hygienist every day, I just teach skill after skill after skill. But usually most people don't know that brushing happens twice a day for 2 minutes with a good toothpaste. Like you'd be
Really?
surprised.
Like that part I figured
That
most
part
people
seems standard.
Yeah.
But
Yeah.
I'm still thinking about the flossing, if I'm being honest, how that goes first.
Yeah. Yeah. You floss after?
All the time.
Oh.
Yeah, me too.
Twice a day.
You're a twice a day flosser. I'm so
I'm
impressed.
typically not.
Yeah.
But yeah, it's there is an order, but if you were to floss afterwards, that would be fine. I just don't want you rinsing after you're done
Oh.
brushing your teeth. But yeah, I mean, effectively removing that plaque in between your teeth and then going in and brushing is going to be more effective. Although, if somebody tells me, you know what, I floss on my way home from work and that's my once a day I floss. A lot of men floss in the car.
Really?
I do
Yes.
love having those little picks,
Yes.
and I just put
Right,
them
like
in, and then I love having
if
those in the
you've
car.
if
Yes.
you've had
Yes.
something and
Yes.
it's bothering
Yes.
you.
Yeah.
But
So,
as part of your regular routine,
yes.
floss in the car. Oh,
Yes. Yes.
interesting.
Keep flossers in their car.
Like while they're driving, they're flossing.
Yeah, they'll do it like most men will say they'll do it like stoplights. And they'll floss their teeth with flossers.
Okay, am I jumping the gun? But are the flossers as effective as flossing?
No.
Okay.
But I will say if somebody wants to use a flosser, I am definitely not going to discourage
Yeah.
that. I feel like a lot of men have a hard time getting their full fingers in their mouth. So for them, maybe flossers are just as effective. But I would say, yes, choose floss over flossers. But if you're going to use something, I don't care what you're using. Toothpicks, super effective.
Really?
Yes.
My grandpa
Yeah.
knew
Like
it.
your whole mouth. You're
Was using 'em.
toothpicking your whole mouth.
Yes. Yeah. Yeah.
Really?
The old men who use
Yes.
toothpicks
Yes.
have extremely clean mouths.
I just picture like
Really?
Yeah.
Okay.
Yeah. The trick to using a toothpick is that you use the old fashioned like wooden ones.
Uh-huh.
You get the tip wet and you kind of chew on it a little bit. So it kind of creates like a flattened edge rather than like a pointy edge.
Mm.
And then they use it and they like scallop the edge and go in between their teeth, and they have the best gums. If anybody's a consistent toothpicker,
look at this.
yeah, those old guys who have toothpick habits are extremely like low risk for losing teeth.
Really?
Yes. Yep.
Oh,
We don't see
okay.
it as much
That's
anymore,
awesome.
but
Okay. Okay. So, we're gonna have you do a demo in a minute
Oh.
of how we should be brushing.
oh, okay.
But
Not on me.
yeah, no, we.
I just washed my hands. Like, what do you think I've been touching that's inappropriate? I can do it.
And we'll do an evaluation of how much plaque you have. Just kidding.
Getting to know you.
Okay, but when you're starting with a child, like let's say from a really young age,
Yep.
At what point do you start brushing teeth? Like as soon as they appear,
I start before.
Okay.
So I will take like a washcloth and I will rub it along the gums just so that like babies start to like get the feeling of you touching in their mouth.
Did you ever do that?
Well, yeah, they had the little like nubby things you could put on.
Oh
and
yeah,
then, like,
yeah. Okay, I maybe have done that. Like
Yeah.
you stick it
probably
on your
with my
finger.
oldest child, and then the other
Yeah.
two. Probably
Yeah.
not.
Yeah, that's true.
So yeah, before they're even broken through, you start using a washcloth just so they're used to that feeling of you having your hands in their mouth, because it's weird to have your hands in
Yes.
people's mouths.
Yeah.
Yeah.
I know. I deal with it every day, all day. And so you start with that, and then as they get a little bit older, then like you start like you can use that same washcloth technique and like brush their teeth, or using a really soft toothbrush. And then you really don't start using toothpaste till they're probably 2-ish. You can use a very, very small amount, and you start teaching the habits of spitting after they're done brushing, because you don't want swallowing. So if they're just swallowing, there's fluoride-free toothpaste out there, and you just use those and you just clean the teeth that they have, just really getting a lot of the plaque off. And then once they start getting old enough to spit, then you can move them into a small amount of fluoride toothpaste.
Okay. So you're doing it like just normal, like twice a day, morning and night
Yep.
with your baby. So I like to talk about things in terms of when they're a helper, and then they're a
Okay.
worker, and then they're a manager. So I guess at that age, even when they're a baby, they're helping because they're opening their mouth,
Yep.
and so they're learning to kind of be a helper at that stage up until at what point do you let them start trying to brush, or do they usually? I mean,
Pretty
sometimes they take it from
Yes.
you.
So pretty early you start to let them, as soon as they start having any sort of fine motor skills, you let your kids start to brush their teeth. But it's always you you do, and then mommy helps or daddy helps or whatever. So it's an always, and then you continue that process until they're probably, fine motor skills really aren't until they're probably about 10 years old. So
Okay.
it's
Mm.
consistent. I call them non-negotiables. That mom helps brush your teeth. Mom helps, just stand in there maybe at a certain point, and we just talk about the day as they're in there brushing and I'm watching. But yeah, brushing your teeth is a non-negotiable. Having mom help you brush your teeth is a non-negotiable. There's other
Because what do you feel
non-negotiables.
like they're missing if they do it on their own? Say they're like 8 or 9. So what are they not getting?
So typically I will say it feels most comfortable to brush the back of the teeth.
Mm-hmm.
And for people who are right-handed, they brush their left side really well, and then they don't brush their right side very well because
Okay.
it's an uncomfortable position. And then they'll brush their 2 front teeth. So this entire middle section,
Mm.
it is totally not brushed for, I would say, 90% of kids.
Really?
Yes.
Yeah.
And they really do like a regression through like puberty where they'll do like
Oh,
a
yeah. I
quick,
know this.
they'll do like a quick brush, or they'll scrub the chewing surfaces and then they brush the 2 front teeth so that mom sees
Right.
that
Yeah.
like they did something.
Yeah.
But really it's like the middle section is totally missed. So, yeah, there are actual sections that our kids are missing, but I'd say the biggest thing is not brushing long enough
Okay.
because plaque is really sticky. It like really adheres very strongly to the tooth. It's a biofilm. It's multiple bacteria with really sticky substances. And so it really adheres hard to the teeth. So you have to use multiple brushes in order for it, multiple strokes to get that plaque off.
Okay, so in your practical life with
Mhm.
your kids,
Yep.
did you have some that resisted the whole rigmarole?
None of my kids did.
That's
Do we know
amazing.
Megan Robbins?
I know.
None of my children actually did. I started with electric toothbrushes really young, and I feel like that really is something that is super key is electric toothbrushes because they have built-in timers. So you don't
Mhm.
turn. Another thing is that I teach all the time is that you never turn an electric toothbrush off. I would say most of them have timers in them. So you
right,
go
right.
until the toothbrush turns off. You never turn off your toothbrush. The other thing is you don't actually brush with an electric toothbrush, you guide. And so really you can kind of just zone out and just kind of enjoy brushing your teeth and you just go for 2 full minutes. But no, none of my children actually fought me on brushing teeth because they knew it was not going to be a battle they were going to win. But you kind of go through stages where you teach them to brush their own teeth, you teach them how those timers work, you teach them how to do things,
Mhm.
and then you watch and then you allow them to do it on their own. And then when they go back into braces, it's mom helps again. It's
I
a
know.
I know.
it's a whole new process that you have to teach because it's like starting all over again once kids go into braces. So it becomes you do it on your own and then you regress back to mom helps you, mom shows you, teaches you those new skills, and then you're off on your own
Mhm.
again. It shouldn't be a very long process of teaching again.
You shouldn't have to like pin them down and do it like I did some of my young kids.
Yes. Yes. Yeah. So it's a totally different thing that you do when you've got kids in teenage years that you got to teach them. And then you also start teaching skills again, like you're drinking soda. Let's talk about this. You might have a boyfriend or girlfriend. Let's talk about this.
Well, and flossing with braces.
Yeah.
That's a chore.
Yeah, it is.
Mm.
So there are certain tools out there to help with that. Waterpick is the number one thing to use when
That's a good
you're
idea.
in braces. It makes a huge mess, and especially if kids are in braces, I tell them to get in the shower with it. So I get the handheld one, not the one that has the like sink unit.
Uh-huh.
I get them for like $20. And because if they drop it or whatever, it's not a big deal. But I give my kids the ones that they can use in the shower and they love them. Yeah. So you just turn on that water pick. You could put mouthwash in it, but most kids will just like fill it up with water and they can have a party in there because it doesn't it doesn't matter
Right. Okay.
that they're
Okay.
making a big water mess.
Yes.
And then they're getting all of that stuff out and it really feels very satisfying to like have a good clean mouth when you're in braces because it's not comfortable to have those braces on,
Yeah.
but also to have plaque and food and stuff sitting in there. I know it's not comfortable. It makes
Right.
your gums feel itchy. It just feels gross. So, yeah, water pick in the shower.
Hypothetically, what do we do if our kids don't care about the gross mouth? Like, I'm not going to say that this has happened to me, but like, it boggles my mind that they think they're getting away with something if they go to bed without brushing their teeth
Oh,
because I can't sleep without brushing
yeah.
my teeth.
Yeah.
But let me tell you,
Yeah.
does not seem to bother a lot of children. I don't know whose.
Someone's out there.
I don't know. I would just say starting really young and having like they know what a clean mouth feels like, it becomes something that they desire themselves. But if they don't want to have a clean mouth, oh, that's at certain
It's
point
hard.
they get a boyfriend or girlfriend and they go, oh well, now it becomes a skill that I want to have.
Right.
But
Like you would think this would be an easy intrinsic motivator. Like
yes,
my teeth feel great,
Yeah.
my teeth
Yes.
look great, my breath doesn't stink.
Yeah.
But sometimes this is not the case. And I'm sure you've had patients
yeah. Oh,
like this. So do you have any tips for the ones who do not have the intrinsic motivation, who just need some external, I mean, candy is not the, I'm
Yeah.
kidding, obviously.
Well, then the hope is the external
Yeah.
will go then internal, right? 'Cause
Right.
then they're like,
right.
okay,
And I was totally
Yes.
kidding about the candy
Yeah.
teeth.
we do what we got to do.
Yeah.
Not that should be a great motivator for
Yeah.
any skills you're teaching your
Yeah.
kid.
And we do what we got to do.
But
Yeah.
yeah.
I don't know. Do you spank them? I don't know. I don't know.
Okay, so I will
Kids
tell
are
you,
never
like,
old enough to
especially with my
No.
toddlers that are like clamping down their lips.
Yeah.
No, you cannot brush my
Yeah.
teeth.
Yeah.
I have been known to
I know.
straddle the children
Yeah.
and open their mouth. Like it's
Yeah.
not, but it's not abusive. I'm not like hurting them. But
None
Just
of us are
enforcing
judging you.
hygiene. We're just enforcing hygiene.
but if they refuse, like it's the non-negotiable thing. Like
Right.
it has to happen. And I try all the things. Like I try to make it fun and pleasant. And I'll tell you some of my tricks since I've had to use some tricks.
Yes.
So for the toddler age, like the sugar bug thing helps. Like if you just like,
Mhm.
let's get those sugar bugs,
Yeah.
and you make it kind of a game. So gamifying it a little bit. I would get like when that would wear off, I'd be like, okay, I see some monkey, like
Yeah.
other random animals or things in their mouth.
Yeah.
So playing that game usually would work with the little ones. Like, oh, let's see what's hiding in your mouth today and discover it, whatever. For some kids, it was just like a 2-minute video. Like you
Yes.
can watch this 2-minute
Mhm.
video while we brush.
Yep.
Sonicare has an app
Yeah.
called Sonicare Kids where there's like a little gross furry guy
Yeah.
that has gross teeth. He's not gross, but his teeth are gross when you haven't brushed, and you can like track
Yep.
whether you've brushed every day, and it times it. It even like shows you pictures of where you should be brushing, and so you get the teeth. So we've used that.
Yep.
We've tried it all because you have to like be novel
Yes.
once in a while. Like you have to
Yes.
try something for a while till it doesn't work, and then try something else. We've tried those like dye things.
Oh,
So
like
that you can
disclosing
see-
tablets?
Yeah, disclosing
Yes. That we
tablets.
used to have like back
Yeah.
in school. They
So it
made us
turns
used to
it-
do disclosing tablets.
Yeah.
and
What
fluoride
is it?
treatments.
What is that actually? What is
It-
the color showing? Like
It
plaque?
adheres to
plaque.
the plaque.
Okay.
So like a light pink will be like plaque that's been there less than 24 hours, and then like the darker pink or purplish color will be plaque that's attached for more than 24 hours.
Wow.
So a lot of times you'll see that and you can be like, this is an area that hasn't been brushed for 2 cycles of brushing teeth. So I used the time where I would go in and brush my kids' teeth as a time to talk about the day. I would have my hands in their mouth and I would just have that as like the one-on-one time before like bedtime so we could like reconnect. And my kids loved their one-on-one time because I would come
But you're
in.
talking to them; they're not talking
Right,
to you.
right. Yes.
Your hands
Yeah, I
in
know.
their mouth.
telling a story
Oh.
or just anything to talk about the day that I'm having that one-on-one interaction with them. And kids thrive on parental interaction. And so I use that time as like my one-on-one. Look them in the eyes, talk about things, and we're getting teeth brushing done at the same time. Or if as they get older, then you start being in there just as support and just talk about your day and whatever. I really liked that bedtime routine with my kids.
Well, I like that to combine it with connection. Like, I'm obviously not pro bribery, like with the candy. Like, it usually doesn't solve any problems, but connection is something that is a very good motivator. If you're like, oh, this is my special time with my mom, nobody else is around.
Yep.
That's part of the problem is that there's usually hooligans running and you know. So, but you can make it like that. Like we're gonna go one by one, which I never did, and I never tried that really. So to make it like a one-on-one special time with each person, that's a great idea.
Yeah.
And then, I think one thing I learned about braces is, and this is a quote from our pediatric dentist. She's told me that your kids have to earn their braces by their dental hygiene. And that is what I wish I would have heard before my first two went into braces, because they got a lot of cavities while they had braces, to the point that it was very expensive. It was extra expensive because the braces are expensive and the cavity filling afterwards.
Yes.
And I'm not going to
Disclose
reveal
the
how
amount.
many, but it was appalling. And so I learned that I should have gone back to that level of checking up on how well they were brushing.
Yeah.
They told me they were brushing, and they, like they were teenagers, so I wasn't watching them brush their teeth.
Yeah.
But
compliance is tricky.
Yeah.
It has to be self-motivated, because you can't motivate.
I'm trying to remember. There was a family that we know that they enticed their children for every dental checkup, right? We're having twice a year. I can't remember the exact numbers, but I think it was like $25 a visit if you did not have a cavity. Obviously, and then they could choose whether they wanted to bank it or if they wanted to cash out. So they could keep building on this.
Okay.
And I think like it went up as they continued with no
That's
cavities. But for them, it was a good system because it highly motivated their children to have good oral hygiene.
checkups.
Yeah,
And it worked
that's
well for their family
creative.
for an external motivation because you're coming out ahead.
Yeah.
Oh, yeah.
Oh,
Like-
for sure.
Yeah, absolutely.
One filling filled, even with insurance, is like $100. So yeah, you're coming out way ahead. If you're paying your kids $25 for each visit. But yeah, you have to find out what works for your children.
Yeah, absolutely.
My
Yeah.
children love the feeling of a clean mouth. And so that was motivating enough for them. Some children don't have that. And so you have to figure out what works for
Right.
your children.
Totally thinking
Right.
my kids.
I know some friends who think a stick of gum is brushing their teeth.
And I will say, it is not all of my children, and I have 5, so it's anybody's guess who I'm talking about.
Yeah.
So I'm not throwing anybody under the bus.
Yep.
For all you know, the one that you know is very clean,
Right.
in their mouth.
Yes.
No, and it's not like they're disgusting, but do they miss once in a while?
Yeah.
Did I have to hold them down when they were kids?
Yeah.
Sometimes I did, and you could say like, well, just wait till a time that's more where they're more compliant. But if they're just never gonna do, like I've had some who are stubborn and they are never gonna let you.
Right.
Yeah.
But it still has to get done.
Yeah.
And so like, I tried all the gentle, pleasant, nice, game, fun ways to do it before I would ever resort to that.
And so very early, I started my kids on like flossers. Even though I knew I could be more effective with floss, I started with flossers because I
they
knew
cannot.
that the biggest step for them was going to start flossing their teeth. So I started them with flossers, and then they use flossers. I have 2 children who still use flossers and are actually quite effective with them. And I have 1 child who uses floss.
Mhm.
I use traditional floss on myself. And so teaching skills and then letting them guide whatever they want in terms of what products they like to use. And I have a couple kids who've transitioned over from different types of toothpaste. Like I have kids who now are using like a nanohydroxy toothpaste rather than straight fluoride toothpaste. And they like the flavor of it. They like the way it feels on their teeth. And so letting them have choices. And
Is that what I use?
is nanohydroxy.
Okay.
And you use yeah. You
That's a
use
very fancy term.
a nanohydroxy toothpaste you use one with fluoride, and then it also has xylitol. So there's tons of different options out there. Fluoride really is the cheapest, most effective toothpaste that we have on the market right now. And I know there's lots of discussion about fluoride out there.
Yeah,
Like
let's talk about that, Megan.
Yeah. Utah just removed fluoride from their water
Right.
altogether.
Yeah. Are their
Colorado,
teeth going to fall out?
I think we're going to see possibly some big issues.
You think there'll be a big
Yes,
impact?
I do. Fluoride is super effective for what it can be, but yes, it does have issues. You don't want to swallow like high amounts of fluoride. We do know that it can possibly cause problems. It definitely upsets your stomach. It can also cause other problems, but we know that if you're leaving it on your teeth, it is highly effective for recalcifying teeth. So we've also been studying a lot of different mechanisms for refluoridating or recalcifying teeth. Like the biggest one right now out there is the nanohydroxyapatite toothpaste that they've been using all over Europe and all over Asia for a lot of years. And hydroxyapatite is actually what our teeth are made out of. And so it's recalcifying in a more natural way, where fluoride is helping to bring ions of calcium into the teeth. It's remineralizing in different ways. So the toothpaste I have you on is one that has fluoridation in a natural way, a nanohydroxyapatite to help rebuild the mineralization, and then the xylitol.
I feel like we're with a chemist right now.
And then there's
hygienist slash chemist, Megan.
I know. And then there's xylitol that also takes like cavities producing bacteria and like neutralizes it. So there's tons of products out there that are really, really effective products. And there's lots of different things. Talk to your hygienist, find out what like is going on in your community, and you can find out lots of fun things. Yeah. All right.
That's
You wanna
really
learn
awesome. Well, it makes a difference. Like
if you've got sensitivity.
Yeah. Like
it's
my
huge
teeth are
difference.
way better. Like with hot and cold and stuff. Like I will never go back, even though I have to pay a little bit more.
Yeah.
So I'll put this here. It'll still pick.
So I use floss, and you use about arm's length, right? So
biggest that much.
That's
a lot of.
So you go around the middle fingers,
so
that you're able to like push and pull with.
That I do.
Yep. So you're able to push and pull. Okay. So you're gonna go up in between the teeth. So I use floss, and you use about arm's length, right? So
biggest that much.
That's
a lot of.
So you go around the middle fingers, so that you're able to like push and pull with.
That I do.
Yep. So you're able to push and pull. Okay. So what you're going to do is you're going to go underneath the contact, and you're not going to hit up into the gums like this point right here. It actually hurts to floss that. So what you're going to do is you're going to pull along the sides, and you're going to sweep underneath the gum line. You're going to pull up and down, and you're going to pull up and down on the other side of the teeth. And then you go on to the next side. This feels so different than actually flossing the actual teeth. And you go up and down, and you pull underneath that gum line, and you go as high up as you want and as high up as you can feel, and you sweep underneath that gum line. If you floss straight up in, you hit this point of the tissue. It's really uncomfortable. I can see why people hate flossing if they're actually flossing like that. They'll just kind of click in and click out. Not super effective, but I want you flossing in and out like that. Same thing with a flosser.
Okay.
I don't know. My kids love their flossers. I love my floss.
I do too.
I like floss. Oh, you like flossers?
I like the flossers, especially the double.
And you're just gonna pull up along the gum line and just go up and down and floss your teeth like that. Some of them have little picks, super effective. You're just gonna, you can tell I don't use these. You're just gonna kind of go in between and kind of scallop the edge, and then you're cleaning, and then you're going in between. So that's how you floss.
Guess since I don't use flossers, I don't do the scallop the edge type. What do you do? Do you use a toothpick? Do you use a flosser pick?
No, I actually don't use either, but I love that they have these on here.
Oh, okay.
But yeah, you can go in between, and then also use your floss and just go in between and really clean the sides of the teeth.
Okay. That was
I know.
very awesome.
So much more than
Well
you
done.
ever
What about
want.
this toothbrush? You got this toothbrush over here, and the size of it is fantastic.
Oh, Yeah. So you're holding and you're brushing along the gum line. The biggest thing is removing the plaque along the gum line. You're doing little circles. And I teach patients like 2 minutes is kind of hard. It's about the length of a song. So sometimes you can turn on the radio or whatever or watch a video 2 minutes long. But what I'll
What if
tell.
you're using, sorry, the electric toothbrush though?
Okay, so you're just going to hold it along the gum line and you're just going to guide.
You're still
So that looks
circling a little
different.
bit.
I do a little bit of circle just to kind of give it a little, but you actually don't have to. You can just guide it along. But if you're using a manual toothbrush, I teach patients start in the back corner, little circles for 10 seconds, and then along each I go 2 teeth at a time, little circles for 10 seconds, and then you move to the next 2 teeth. And that way you're working in a pattern. And then you make your way to the other back corner, and then you go to the inside, back corner to back corner, drop to the bottom, back corner to back corner. This person has not flossed, and so they have lost back teeth. I know. This one has actually been vaping, because these are the teeth that you lose when you vape, is these side teeth. Vaping's a huge issue with teenagers, I'm finding out. And we're finding out that they're losing bone up around their side teeth. So I'm seeing kids in their 20s who've been vaping for a couple years,
Yeah.
and they are actually losing significant amount of bone in the teeth, not the center teeth, but the 2 teeth off to the side. And their canines is the biggest issue. So this person has had an issue with vaping because they're losing bone.
You need to
around.
go into the high schools, Megan.
Oh, I've tried. I have a pamphlet in my office about vaping.
Yeah.
So
Yeah.
vaping more than like smoking?
Yes, it's very interesting. I don't know what it is about the position of the vape pen or whatever they're using,
Yeah.
but specifically vaping, I am seeing issues that we are seeing bone loss around the upper 2 teeth, just off to the side.
And you said
that-
as early as their 20s?
yes,
I mean,
I am seeing
that's kind of astonishing.
I'm seeing
Yeah.
significant bone loss in very specific teeth. And those are not pretty teeth to lose.
No.
So, yeah, it's been very interesting, because now vaping's probably been around for 10-ish years. And so we're starting to finally see the trends that we're going to create issues. So-
And if there's bone loss, does that mean it's hard to do implants too?
Yes, if once you've lost that bone is gone, unless you want to do a bone graft. But
You have to do like a bridge if
yeah,
you're gonna.
yeah. I mean, we're seeing significant bone loss. So I'm not saying don't vape, but I am.
Yeah, you
Yeah.
can say don't vape. You can say don't vape.
I think it's-
I
I'm
think
not making
we're all on
excuses for
board.
you. I'm
We're
not
all on
you.
board with this.
So yeah, I think that we will see eventually a lot higher risk for oral cancers.
Right.
But currently, right now, the one
We're
thing
not
I
far
am
from out.
seeing
Yeah.
for sure is that kids are losing bone in their early 20s.
Man.
Yeah, it's really, really early.
That's really sad. Okay, so since we're talking about scary things, what are some other scary things you see as a dental hygienist, and what can we do to prevent them?
I would say the number one thing that I see that's an issue right now is energy drinks. Super high sugar and super high in terms of acidity. And so the combination of which, we are seeing cavities unlike rates that we've ever seen. Kids are coming home from college and just have cavities everywhere. So I'm saying right now in dentistry, the thing that I'm really not enjoying is energy drinks. They do have a higher acid and a higher sugar than traditional sodas. And so it
Yeah.
really is quite amazing what it is doing to teeth. So I would say no energy drinks at all, just from the dental perspective. But I will say it's also really bad for your heart, and they've got a lot of chemicals in it that are just gonna create big issues. I don't like
Yes.
I don't like soda either, because
Yeah.
it has a high sugar and high acid, but nothing compared to energy drinks. Like some kids, they really, really will say, I can't get rid of my energy drinks. So I'll just say, you know what? If you have an energy drink, you have to drink it
water.
down.
Yeah.
Drink it down, be done with it. water afterwards to really decrease that high acid count in your mouth and get rid of a lot of that sugar. Make sure you're flossing your teeth on those days, and just really using a great toothpaste and
Mm.
brushing and flossing twice a day. Yeah, it's the scariest thing I'm seeing right now.
Are there any other hazards that we should warn people about? Maybe for young kids, juice
Yes,
and sippy
juice.
cups, that kind of
fruit
thing.
snacks. What about fruit
Oh,
snacks
Yes,
and like
they're
they got, like,
sticky and they're sugary, and so they really do adhere to the teeth really strongly. So, no juice before bed, no milk before bed,
Mhm.
because milk actually does have a lot of sugar in it naturally. So you will have those things, and then you brush and you floss, and then
Yeah.
you go to bed. So, kids shouldn't have anything in their sippy cups other than water. You don't use juices or milk. You just use straight water and sippy cups if kids are going to
Mhm.
be drinking throughout the day. But you can have milk or juice with the meal, but
Yeah.
not on its own.
And like I had an aunt who was a kindergarten teacher, and she would put a tooth in a bottle of Coke and it would
Oh,
dissolve.
yeah. I've
Yeah.
heard this too.
They
And this
can.
is true.
High sugar, it'd take a while, but high
Right. It
sugar
took
and
a
high
while.
acid
Yeah.
will definitely
Just eat away at
rip
it.
enamel.
Yeah.
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 So I would propose that as our first experiment for dental hygiene. If your kids are arguing, I did that with my young kids. We didn't do it till it dissolved, but we did it for a couple days, and you could tell, like, it discolored it and it
Yeah.
looked gross.
Do you want me to get you some teeth so that you can do
Oh.
experiments on?
Oh my gosh.
I have access.
That is like the worst prank. So I just drop off some teeth for you.
Who does that? We did it with a baby tooth. We did it with a baby tooth that died.
I say I might have access to teeth.
To this nasty
Oil
coming
thing.
in.
I'll put it on the autoplay. But
I think my kids are
Try
old enough
energy
to
drink?
just with an energy drink.
yes.
Let's do that experiment. Yes,
See, she's in. Don't act like I'm crazy.
but I'm a little weirded out by the tooth. By somebody
autoclave
else's
it.
tooth. Okay, I'm open.
Does
I'll
this
take the
patient,
tissue
does
off.
this
I'm open
patient
to
have to
this.
sign any rights that their body's going to science?
I mean, why does it sound more palatable to me to do it with my own kid's tooth? It shouldn't matter, right? A tooth is a tooth.
I don't know. The jury's still out on that one for me.
Okay. Well, this.
But I also have things with the dentist, so I'm still working through this.
Okay, I am open to this idea,
Okay.
and we will not disclose who.
I would
tooth it
actually
is.
love to observe. I just don't want
Okay.
to be any part of the donated tooth. Thank you.
Okay, let's do this with the
Yeah.
with a
Yeah.
tooth and an
Energy drink.
energy drink.
Okay.
Okay, stay tuned. We will follow this experiment
Yes.
on Instagram is what we'll do, and maybe on the podcast. I don't know. We'll see. But yeah. Okay. So that's our first experiment. We're gonna do a tooth in some energy drinks just
Yes.
to show the effect. Okay. What are some
I-
other experiments that we could do at home? The parents could try. Maybe let's talk about an experiment for getting kids on board with being able to be brushed.
My kids loved the screen when they got to a little bit older age, trying to battle that 2 minutes. I think it was a Disney app that had the brushing, but I don't know. Is that what we're talking about? Like an experiment like that?
Yes,
Like try.
exactly.
That didn't work for the rest of time, obviously, but for a period, it really helped with the 2 minutes because they liked the screen. And then what you're saying is kind of supervising, making sure they're not just stuck here as they're watching, but like
Good point.
going around the entire mouth.
Yeah, I think that's great. And then should we make the third experiment be the what are they called?
Closing
yeah.
tablets.
Disclosing tablets. You can get them on
Boy.
Amazon cheap or wherever.
Yeah.
It feels like a truth serum.
I
It's like,
know.
oh, you've been brushing your teeth?
Yeah.
Let's see.
Try that.
Yeah.
Yeah. When I worked in pediatrics, we would disclose every single patient that walked in. And it was very interesting. I don't disclose now in a general practice because it gets everywhere. So make sure you're in a place where you can spit into a sink that they're not
Yeah.
going to create a big mess because it really
It
does
is messy.
dye everything.
Yeah.
But yeah,
Especially if you're struggling. Like that was a big awakening for my kids to be like,
mm-hmm.
oh, because you do it after you brush.
Mm-hmm.
And then you can see like, oh, I just brushed and there's that much left. So I do love that experiment if
Yeah.
you haven't tried that.
Yeah.
I think there's two-tone disclosing tablets or just like disclosing tablets. I
Mhm.
haven't looked for a very long time, but I think
Because
they
your kids
probably
are
have
good
some.
at it.
Yeah.
I would hope so. I would hope
yeah.
so.
Okay. So another thing, this is a longer term experiment. I am always way better at monitoring my kids after I've just been to the dentist and been like shamed, like, oh, it's been a while. And are we flossing every day? Are we like,
Right.
am I up on it? Like,
Right.
it's always a wake up call for me. So I'm really good, like right before we go to the dentist
Yes.
and then right after we go to the
Yes,
dentist.
I would say that's probably the case for most people.
So I used to, and this is more applicable for people with multiple children, but I used to like try to stack their dentist appointments at the same time
Yep.
for efficiency and convenience
Mhm.
sake. And about 4 years ago, I started doing them single so that I had, as a mom, I had more reminders throughout the year. So
Oh.
I
Oh.
don't time them at the same time. It's my little hack
Yeah.
for those of us who may not be always on top. Like, I'm not at my best
I
at
love
night.
this, Whitney.
You know, for
Yeah.
me, that's what it takes.
Yeah.
And I should just be good all the time, but I'm not. And maybe some of you are in my same boat. Maybe
Yeah.
I'm gross. I don't know. Probably both. I don't know.
She has a lovely mouthful of teeth, healthy
Yes.
teeth.
I do have all my teeth, even my wisdom
Yes,
teeth.
she
Oh,
does.
wow.
Yeah.
Puppies are long gone for me.
Yeah.
Yeah.
I have a big mouth. I just keep them all.
Yeah.
As you know from the podcast, I have a big mouth. Can also fit my fist in there, but I'm not going to do that right now.
Oh,
Sorry, God. Can you really?
give the people what they want. I don't
You
think
really
she can do
I
it.
don't know if we'll keep
I
it
don't
in,
think
but
she Ooh, she can do it. She
I
can
have my job. You didn't know you were in for that today.
That was new.
I can also yodel, but we don't need that.
This is fantastic.
Yeah. So is there anything that we have failed to mention? Anything more that you've done to motivate your kids?
No, I mean, just threats. I don't. No, I don't. I feel like the tips you gave were really good. They do have a great pediatric dentist. And I mean, we've had the cavities, though. They've still had cavities at times. I don't really have a great motivating system.
I'd say
I
the
don't-
biggest thing is do what's right for your kid and you. Like my kids love the one-on-one time. If your kid works really well with like a schedule, like that they could put little stickers on, or they really like electric toothbrush, or just
yeah.
switching things out, or letting them go to the store and choose what flavor toothpaste they want.
Or what
Or-
character on the toothbrush?
Yes.
Or,
And
yeah.
Emma does love a water pick.
Yes.
She has braces right now, and she liked a water pick before, but now it is really helpful. I should mention the shower, though. Maybe a different one.
Mhm.
That's a good tip.
Yeah. Kids love
Mhm.
it. It's tricky with braces. Like you have to get so many crazy angles.
Mhm.
It just goes everywhere. And so I love to tell my kids, brush in the shower.
Yeah.
Floss in the shower. I don't care.
And one thing we've done so that I have a visual confirmation that my kids are flossing when we're good about it is we try to gather for like scriptures and prayer at night
Mhm.
before bed, which sometimes we're better at that than others too. But for a while, I was just handing out flossers while we did our scripture
Oh,
study.
there's no reason you can't.
Yeah, and then even if it's, I guess it's not out of order, flossing is first, right?
Yeah.
So then I was seeing that they were flossing, and it was like a habit stacking type thing. Like,
Mhm.
Yeah.
we're already doing this. We're just going to pass these out. Check, that's done. It's not keeping you from doing something else that you want to do.
Mhm.
So that's another tip I have. But some kids will say they've flossed and they haven't. So, like
Yeah.
sometimes it's good to get a visual
Yeah.
of them flossing at least once in a while. So, it's happening sometimes. And yeah. And at the dentist, when they ask, do you want a fluoride treatment? Do you always say yes? Do you say yes every other time? If you're already using a prescription toothpaste, do you still do it? Just do it every time?
Yeah, it's a great question. I would say depends on what your needs are. If you're really high risk for cavities, yes. If you have really high sensitivity, yes. But if you don't have sensitivity and you really aren't high risk for cavities, then I would say you probably don't need it.
Okay. Okay. Do we have any other questions for our expert while we have her?
Gosh, you're so good, Megan. So good. I don't know if I call you a chemist or a hygienist.
Or just
It's
me.
very impressive. No,
Okay. Well, happy brushing, everybody. Good luck. I know it's sometimes harder than others, and yeah.
You got this.
Whitney
Yeah.
has tips if you need to pin your kids down.
I know. Will I come to your house and pin your children down? No, I will not. Oh man, I could talk to these women all day, and luckily I do get to hang out with them a lot in real life. So thank you for joining us this time and listening to the Family Lab podcast. You can find more resources, including a downloadable hygiene skills checklist for your kids, at familylabpodcast.com. If you subscribe to my newsletter anytime during February of 2026, you'll get that checklist for free in your inbox. Thanks to my podcast managers, Kimberly Hansen and Haley McElroy. And as always, thanks to my mom, Susan Singley, for playing the theme music for my podcast. She used to play this song all the time when I was growing up, and to me, it's the soundtrack of motherhood.